South Africa recorded high rates of teenagers who delivered babies at public hospitals both on Christmas and New Year's Day. The country also saw a sharp rise in the number of teen mothers on both days as compared to previous years. Well, according to a Human Sciences Research Council November 2023 survey, HIV prevalence among adolescent girls and young women aged between 15 and 24 is at 6.9%, while infection rates are at 3.5 for boys and young men in the same age group. Now, this is often attributed to sexual relationships with older men, linked to factors such as transactional sex, poverty and gender inequality. Just how rife is this problem in South Africa? What can be done to protect girls and young women? Well, to talk to us about this, we're joined by Dr. Mvuyisi Mzukwa from the South African Medical Association. Dr. Mzukwa, very good evening to you. Thanks for joining us. Welcome.
Good evening to you. Good evening to you and to you. Thanks for having me.
Now, Dr. Mzukwa, public hospitals reported unusually high numbers of teenage deliveries on Christmas and New Year's Day. Can you perhaps confirm for us the exact figures and how do they compare year on year over the past decade? And broadly speaking, just how do these spikes fit into the broader trend of teenage pregnancies in South Africa? Are these isolated anomalies or symptomatic of a worsening crisis?
Well, thank you so much for your question. Let me start by saying that we do not have statistics yet regarding the recent holiday in terms of the Christmas Day and also the New Year's. That information, I'm sure, will be available later. What we do know is that we have a serious challenge of teenage pregnancies, which is not just seasonal. Whilst, ourselves and probably you, the media as well, are really talking about, this after Christmas Day and New Year's Day. But the underlying problem is really a year-long public health issue that is facing this country. It's not confined to holidays alone. And the seasonal spikes that is reflected or reflect conception patterns. But the broader trend is that we have high teenage fertility that persists throughout the year.
Indeed. Now, Dr. Mzukwa, the Human Sciences Research Council survey shows that HIV prevalence amongst girls and young women aged between 15 to 24 is at 6.9%. That is almost double that of young men. So to what extent then is early pregnancy an indicator of the broader sexual health vulnerabilities, including HIV transmission?
This is a serious problem that we are facing as the country. We are facing a challenge where you find that young girls are really vulnerable, like you said. The statistics are showing there. 7% for females at the age of 15 to 24, and about 3% for males in the same age group. So there's obvious gender disparities there, where you find that adolescent girls and young women continue to carry this disproportionate share of new infections. And it's not only a South African phenomenon, it's a global and a regional trend that is noticeable, where you find that adolescent girls are 3 to 6 times more likely to acquire HIV than their male peers. And obviously, this is a systemic problem that is faced by girls, young girls and teenagers in our country, where you find that they drop out of school because of pregnancy. They also are unemployable. They remain poor, and that cycle continues.
In as much as this is a global phenomenon and is not only confined to South Africa in particular, but why are South African teenagers still struggling to access and use contraception effectively? I mean, are clinics adequately resourced and young people empowered to access sexual health services?
I think the challenge is that we need to make sure that there's enough sex education among our youth. but also that information is made available everywhere in our social media. It is available everywhere where the youth is. But also, we need to take away the stigma in when they access healthcare services. Yeah, because you find that instead of educating the youth, people are really, scolding the youth and, making them run away from healthcare services, when actually they should be, giving information, empowering the youth, making sure that, they remain at school, but they remain responsible for their healthcare. So that is what is happening. But the other problem is that you find these, systemic problems like poverty, where you find that older men then take advantage of those poor households and find themselves, making pregnant girls that are very young, sometimes even younger than 15 years. I think it's a great thing, to our country to have men that are really taking advantage of young girls.
I mean, you've just cited, the age disparities in relationships with older men as a key driver. But then from a medical and social perspective, just how pervasive is this phenomenon in communities across South Africa? Is there perhaps, evidence to show that it is increasing?
Well, as you can see, it is really increasing. We look at the HIV statistics. I mean, there are reports that every day we get about 365 new infections, among young people. So you can imagine that among those, in fact, 365 pregnancies or deliveries among young people, and 10 out of those usually are people who are less than 15 years of age. Then it tells you, where the problem is, because if you have that statistic, at that age group, it means there are systemic issues that are happening at that level.
All right, Dr. Mzukwa, I think we have lost you. We have unfortunately lost Dr. Mvuyisi Mzukwa. Well, he's from the South African Medical Association, just unpacking for us the troubling spike in teenage births recorded at the public hospitals on Christmas Day and New Year's Day. I mean, that's a pattern that reflects a deeper systemic crisis facing young people in South Africa.